Extract 1. Questions 1 to 12. You hear a psychiatrist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Dr. Sargon. Thank you for seeing us today.
Good morning, Mihiraa. It's my pleasure. How can I help you and your child today?
Well, my son, Morris, was diagnosed with autism 6 months ago. He's 5 years old. We've been trying to understand how to best support him and manage his needs. It's been a bit overwhelming, to be honest.
I understand. It can be a lot to process. Can you tell me more about Morris's behaviors and any specific concerns you have?
Of course. Morris has always been a bit different from other kids his age. He doesn't seem to understand or respond to social cues, which makes it hard for him to interact with other children. He has difficulty with social interactions and often avoids eye contact. He also has repetitive behaviors, like lining up his toys in a very specific way and getting upset if they're moved.
Those are common traits in children with autism. How is his communication?
Even though he's verbal, his speech is limited. He tends to repeat phrases he's heard rather than using original sentences. Sometimes it feels like he's in his own world and not really engaging with us. It's heartbreaking because I want to connect with him more.
I can understand how challenging that must be. Have you noticed any particular triggers that cause him distress or any situations where he seems more comfortable?
Yes, he gets very anxious in noisy environments and around unfamiliar people. He's more comfortable at home where it's quieter and more predictable. We try to keep a consistent routine, which seems to help a little. But any change, even small ones, can lead to a meltdown.
Consistency is indeed very important for children with autism. Have you tried any therapies or interventions so far?
We've started speech therapy and occupational therapy. The therapists have been wonderful, but progress is slow. I just want to make sure we're doing everything we can to help him develop and be happy. It sounds like you're already taking some great steps. Early intervention can make a significant difference. In addition to speech and occupational therapy, applied behavior analysis therapy can be very effective for children with autism. Have you heard of it?
Yes, I've read a bit about it, but I'm not entirely sure how it works or how to get started with it. The therapy focuses on improving specific behaviors such as social skills, communication, reading, and academics, as well as adaptive learning skills like fine motor dexterity, basic life skills, hygiene, grooming, and domestic capabilities. It's highly individualized and involves working with a therapist to set goals and track progress. I can refer you to a specialist who can assess Morris and create a tailored plan for him.
That sounds promising. I'm willing to try anything that could help him. Is there anything we should be doing at home to support his development?
Yes, definitely. At home, visual schedules and social stories can help him understand what to expect and reduce anxiety. Also, you can continue to provide a structured and predictable environment. Encourage communication by creating opportunities for him to express his needs and desires, even if it's through nonverbal means initially.
We've been using some picture cards for communication, and it seems to help a bit. I'll look into your recommendations as well.
That's a great start. It's also important to take care of yourself and seek support when needed. Caring for a child with autism can be demanding, and connecting with other parents in similar situations can provide emotional support and practical advice.
Thank you, Dr. Sargon. I appreciate your advice and support. It's reassuring to know that we're not alone in this.
Extract 2. Questions 13 to 24.
Hi, Dr. Cole. Thanks for seeing me on such short notice. I've been having this persistent ache in the left ankle, and it's really been affecting my training.
Hi, Mihiraa. No problem at all. I'm glad you came in. Let's start by getting some details. What kind of training are you undergoing?
Well, I'm a sprinter, so my training involves a lot of bursts of speed. I do interval training on the track, where I alternate between sprinting and jogging to build up my endurance. I also do weight training to build muscle strength, which helps me explode off the starting line.
Oh, that's great. Can you describe exactly where the pain is and when it started?
Sure, the pain is mostly around the back of the ankle, just above the heel. It started a few weeks ago, but I thought it was just a minor strain. It gets worse when I'm sprinting or doing any kind of intense workout. Sometimes it even aches when I'm just walking.
I see. Have you noticed any swelling or something different in the area?
Yes, there's some swelling, especially after a hard training session. And it's definitely stiff in the mornings when I get out of bed.
Based on what you're describing, it sounds like you might have Achilles tendonitis. It's a common injury, especially for athletes like yourself. Have you tried any treatments so far?
I've been icing it after training and trying to rest it as much as possible, but it's tough with my training schedule. I haven't taken any medications yet.
Those are good first steps. Your condition can be tricky because it requires a balance between resting the tendon and maintaining your training. Let's discuss a plan to manage and improve the situation.
What do you suggest? I really can't afford to take too much time off training, but I also don't want this to get worse.
Understandable. First, we should reduce your training intensity for a while and focus more on low-impact activities that don't strain the tendon. Swimming or cycling could be good alternatives. We'll also incorporate some stretching and strengthening exercises specifically for the Achilles tendon.
That makes sense. How long do you think it will take before I can get back to full training?
It's hard to say exactly, but with proper care, you could start to see improvement within a few weeks. Full recovery might take a few months, but it's important to listen to your body and not rush the process. We'll also use physical therapy to help speed up the recovery and ensure you're doing the exercises correctly.
I really appreciate your help, Dr. Cole. I just want to get back to my best as soon as possible without risking a more serious injury.
I understand completely. Being an athlete, we'll monitor your progress closely and adjust the plan as needed. Remember, it's crucial not to push through the pain. Your long-term health and performance are the top priorities. We'll work together to get you back on track.
Thank you so much. I'll do whatever it takes to heal properly.
Great to hear. Let's get started with a physiotherapist referral and set up a follow-up appointment in 2 weeks to check your progress. If you have any concerns or the pain worsens, don't hesitate to contact me. That is the end of Part A. Now check the answers.